Hi, welcome back to our channel here at Antai Hospital, and we'd like to continue on the discussion of PCOS treatment and diagnosis. And in today's video, we'd like to discuss an important question that we get regularly, especially with our PCOS patients, which is whether or not they can go for IVF as a form of treatment for PCOS. So what this patient means in this question particularly means that she intends to get pregnant. She is experiencing recurrent miscarriage and also difficulty in conceiving and also infertility. She already knows that. However, she does not know that this PCOS is in fact a presence of abnormal testicular tissues within the ovaries, and only surgery is effective for this sort of condition. Now, she doesn't know that she needs surgery. She wants to get a pregnancy as soon as possible, and she wants to go for IVF. Can that be a viable solution for her? So for all you viewers who have PCOS and also have the same intentions, please think carefully. First of all, IVF is not a form of treatment. It is simply assistive reproduction, which means it helps you get pregnant, but it does not remove the abnormal testicular tissues, which means even if you do manage to go for IVF, your ovarian defected cells are still present. They are still in the ovaries. They are not removed, which means, first of all, your ovulation is not going to work properly. Second of all, the quality of eggs is of lower quality. That's a standard characteristic of PCOS patients. So even if you go for IVF, there's a very high risk of another miscarriage, another difficulty of implantation. You're going to waste hundreds of thousands of dollars down the drain, and they cannot even guarantee success because, first of all, IVF is not a form of treatment. So even if you do get pregnant, you do manage to get pregnant, this baby might have some form of health defect or physical defect because of the lower quality of eggs. That's why we urge you to not go for IVF. Go for treatment first. Surgical treatment is very straightforward and direct, and after that you do not need to waste any more money on IVF because natural pregnancy can be achieved. Now, there are patients who tell me that they have gone for surgical treatment of PCOS, but they still struggle. What is the cause behind that? Why don't they just go for IVF? Now, for this type of patient, it's because there has not been a full systemic diagnosis. PCOS patients usually have another underlying uterine malformation. Common ones are septate and naive uterus. They come together because they are all very closely linked during the embryogenesis formation process. So usually PCOS patients, they also have a septate. Patients usually also have a naive uterus, or they may also have a cervical insufficiency or short cervix. Different classifications of PCOS patients. That is why it's important to not only get your PCOS treated, you want to get your other underlying condition, whatever it may be, it must be firstly diagnosed and properly treated. So first of all, not only do we need you to confirm that you have PCOS, we need to identify what is the second problem, or even in rare cases, there is a third factor as well. If you achieve treating all three factors, that's how you get full recovery from this condition. And that's how you have natural pregnancy without any assistance. This is all entirely possible at Antai Hospital. With our years of experience, over 2 decades, we are very familiar with all the different types of classifications of PCOS, what type of complications you may have, what type of underlying alternative factors do you have, how many factors are there altogether, and we can have it treated all together at a much lower price and a much more effective outcome. This treatment comes with a full refund guarantee. If you cannot achieve natural pregnancy after receiving our treatment, then we are obligated to refund you full treatment costs. That is our word. That is our assurance. We are the only hospital in the world to offer you this type of guarantee, this type of full refund, because we are that much confident in our expertise, and we want our patients to trust in our skills and treatment outcome as well. So if you are interested in this form of treatment for PCOS, which is surgical treatment where we remove these abnormal tissues and we keep the healthy tissues, do not depend on medication and do not blindly go for IVF. So I hope you've learned something in this video. If you'd like to seek the treatment itself, please visit the website get in touch with us. Leave some comments down below as well, and stay tuned to the next one.